Every year, millions of seniors take medications to help them sleep, breathe easier, lower their blood pressure, and manage anxiety or pain. But what if some of these common medications, trusted by doctors and patients, could be quietly taking away something even more precious than health? Their memory, their clarity, their sense of self, and in some cases triggering symptoms of dementia. Today, we're going to reveal 9 types of medications that may silently contribute to memory loss, confusion, and cognitive decline in older adults. And we'll hear from real people whose lives were forever changed. Starting with number 1 on the list, opioids. Common medications in this category includes oxycodone, oxycontin, hydrocodone, Vicodin, morphine, MS-Contin, fentanyl, Duragesic, and codeine. Opioids are powerful pain relievers, but for seniors, they can be a cognitive landmine. Meet James, a 72-year-old retiree who had back surgery. His doctor prescribed oxycodone. Within weeks, James became forgetful, repeating stories, misplacing things. His wife thought it was just aging, until he got lost driving to the grocery store he'd visited for 30 years. Second on the list is benzodiazepines. Benzodiazepines common medications in this category includes diazepam Valium, lorazepam Ativan, alprazolam Xanax, clonazepam, Klonopin, temazepam, and Esteril. Benzodiazepines are often prescribed for anxiety or insomnia, but for older adults, they've been directly linked to increased risk of Alzheimer's. Margaret, 76, was prescribed lorazepam after her husband died. It helped her sleep at first, but her daughter began to notice something was off. Margaret would forget appointments, repeat questions, and eventually forgot her grandchildren's names. Number 3, muscle relaxants. Common medications in this category include cyclobenzaprine Flexeril, carisoprodol Soma, methocarbamol, Robaxin, baclofen, Lioresal, tizanidine, Xanaflex. Muscle relaxants are often prescribed to relieve muscle spasms, pain, or stiffness caused by a variety of conditions. But muscle relaxants can also cause sedation and confusion, especially dangerous in older adults. Harold, who is 68, took baclofen for a pulled-back muscle. Just a few days later, his wife found him wandering the house at night, confused and agitated. Number 4, first-generation antihistamines. Common medications in this category includes diphenhydramine, Benadryl, Unisom sleep gels, chlorpheniramine, chlortrimeton, hydroxyzine, Vistaril, Atitax, promethazine, Phenergan, cyproheptadine, Periactin. Antihistamines are prescribed to treat a variety of conditions caused by an overactive immune response or allergic reactions. It's common in allergy and sleep medications, but these antihistamines actually block a brain chemical that's essential for memory and learning, called acetylcholine. Diane, who is 70, started using Unisom to help her sleep. Within just a few weeks, she felt groggy and disoriented. She forgot birthdays, where she was going, and wow, even her own address once. Number 5, sleep medications. Common medications in this category includes zolpidem, Ambient, azopiclone, Lunesta, temazepam, Restoril, Zaloplan, Sonata, Doxepine, Silenor. Sleep medications are typically prescribed to help people who have trouble sleeping, a condition known as insomnia. They promise sweet sleep, but for seniors, they may deliver confusion, falls, and memory loss instead. Here is George, 74, took zolpidem nightly. He slept, but couldn't remember conversations the next morning. Number 6 is statin. Common medications in this category includes atorvastatin, Lipitor, simvastatin, Zocor, rosuvastatin, Crestor, pravastatin, Pravachol, lovastatin, Mevacor. Statin medications are primarily prescribed to lower cholesterol levels in the blood, especially low-density lipoprotein, LDL cholesterol. Statins are lifesavers for heart health, but in rare cases, they've been associated with cognitive side effects. Rose, who is 79, started taking atorvastatin. After a few months, she just couldn't recall simple words or remember her morning routine. Number 7, proton pump inhibitors. Common medications in this category includes omeprazole, Prilosec, esomeprazole, Nexium, pantoprazole, Protonix, lansoprazole, Prevacid, rabeprazole, Actifex. Proton pump inhibitors medications are primarily prescribed to reduce the amount of acid produced in the stomach. They are used to treat a variety of acid-related conditions. Alice, who is 73, took omeprazole for years. She began showing signs of confusion and, irritability. Used for acid reflux, proton pump inhibitors, or PPIs, may increase the risk of dementia with long-term use. Number 8. Antipsychotics. Common medications in this category includes risperidone, dispersal, olanzapine, Zyprexa, quetiapine, Seroquel, haloperidol, Haldol, clozapine, Clozaril. Antipsychotics medications are prescribed primarily to manage mental health conditions that involve psychosis, which refers to a loss of contact with reality. These drugs are sometimes used off-label for seniors with agitation. But, they can cause sedation, increase the risk of falls, and even accelerate cognitive decline. Beatrice, who was 82, was given Seroquel in her care home for what they called behavioral issues. Within just a few weeks, her speech slowed down, her responsiveness really dropped, and sadly, she no longer recognized her daughter. Number 9. Tricyclic antidepressants. Common medications in this category includes amitriptyline, Elavil, nortriptyline, Pamelor, imipramine, tofranil, doxepin, Silanor. Tricyclic antidepressants medications are prescribed for depression, anxiety disorders, chronic pain, and OCD. These older antidepressants, they affect neurotransmitters like acetylcholine, which is actually vital for memory. Frankie, who is 75, was given amitriptyline to help with chronic pain and sleep. But, soon after starting the medication, she began experiencing hallucinations and had trouble with her short-term memory. These stories aren't shared to scare you, but really just to inform you. Medications have the power to heal, but they also carry risks, especially for older adults. But, be your own advocate. Ask your doctor questions, stay informed, because your memories, your clarity, your you are worth protecting. If you found this video helpful, give it a thumbs up and share it with someone who might need this information. And if you have a story to share about a medication's effect on memory or clarity, leave it in the comments. You might help someone else feel less alone.